If you are an anatomy or medical student, cranial nerves have likely brought you to the edge of burnout. 12 nerves, 12 names, 12 numbers, and your lecturer expects you to know them all by tomorrow morning. But there is a mechanical method for organizing these facts. You can build a complete reference grid using just 2 sentences. Pause this video right now, grab a blank sheet of paper and a pen to follow along. By the time we finish writing, you will have a structured system designed to handle any cranial nerve question on the exam. Start by writing the numbers 1 through 12 vertically down the left margin. This is your foundation. Next, write this sentence, word by word, next to the numbers. On old Olympus' towering tops, a Finn and German viewed some hops. 1 word for every row. The first letters lock the nerve names into the correct order. Rows 1, 2, and 3 all start with O: olfactory, optic, and oculomotor. To keep them straight, think of the sequence you experience walking into a kitchen. First you smell the food, then you see the food, then your eyes move toward the plate. Pay close attention to rows 4 and 5. Both start with T, which is where many students lose points. Number 4 is the trochlear nerve, and number 5 is the trigeminal. Moving down to the A and F. Row 6 is abducens, which moves the eye outward. Row 7 is the facial nerve. Here is the second common mistake. Do not confuse the A from row 6 with row 8. Number 8 is the auditory nerve, responsible for hearing and balance. To finish the list, German is glossopharyngeal, viewed is vagus, sum is spinal accessory, and hops is hypoglossal. Every nerve is now assigned to its correct anatomical number, anchored by that 12-word phrase. Recalling the names is only half the task. Exams also require you to identify if a nerve is sensory, motor, or both. In a new column to the right, write this second sentence. Some say marry money, but my brother says big brains matter most. The first letter of every word indicates the nerve's function. S for sensory, M for motor, and B for both. Convert those words into their single-letter shorthand down the column. This aligns each classification with its corresponding nerve name automatically. You no longer have to memorize each function individually. You simply read across the row you've built. To apply this grid to clinical questions, you should link specific physical actions to the highest yield nerves. Nerve 5, the trigeminal, handles both facial sensation and chewing. If a test question describes a severe toothache, the trigeminal is the nerve involved. The facial nerve, number 7, controls all facial expressions and carries taste from the front 2/3 of the tongue. Nerve 10 is the vagus. It is often called the wanderer because it travels down into the chest and abdomen to manage heart rate, voice, and digestion. The spinal accessory nerve, number 11, is entirely motor. It handles the specific action of shrugging the shoulders and turning the head. Nerve 12, the hypoglossal, is responsible for all tongue movements, including speaking and swallowing. Note this classic exam detail. If the hypoglossal nerve is damaged, the tongue will deviate towards the side of the lesion. By adding these clinical triggers to your margins, you have created a comprehensive map for the entire cranial system. Look at your paper. You have organized a complex anatomical system into a readable grid in under 6 minutes. Your immediate study plan is to recreate this 2-column grid from memory twice before you go to sleep tonight. On the day of the test, write this matrix on your scratch paper the moment the exam starts, before you even look at the questions.
Share this technique with your classmates and subscribe to Anatomy Corner for more strategies that turn complex subjects into clear logic. See you in the next one.